Pooja and I were trying to have a kid for a while. We'd had multiple failed pregnancies, and then she went through this process over many years of feeling like she was failing at something.
Yeah.
And that really hit her hard.
I really got Pooja. After 8 failures, after 3 miscarriages, almost bled to death, severe complication after IVF, fringe cases.
Yeah, that's actually the thing, right? Is that there's this word that's used called, failing.
Our first kid is also IVF. I thought at that point of time that, are we ruining the natural order of things? The burden of IVF is much higher on the female partner.
On all cases.
In literally all the cases. Yeah. I mean, women are becoming stronger now. Even in tier 2, tier 3 cities, they're like, no, you get yourself tested.
The process of wanting to have a child and then going through things like infertility, trying to understand aspects like IVF, or should you even freeze your eggs, freeze your sperm. There's so much around that which most of us don't know about till it actually hits us, till that actually happens to us and we have to go through it. And a lot of these questions come in then. But so many aspects of this things that we all need to know more about. And that's why I have Dr. Munjaal Kapadia on the show today. He was our doctor. When I say us, for me and my wife Pooja, he was our doctor who walked us through this process for both our children. There's so much I have learned from him, not just about the process, but about how to deal with it, not just physically, but mentally and emotionally. And so I'm going to make him answer all the relevant questions about this space, but more importantly, give you all the things that you need to think about, you need to register, and the questions you need to ask yourself. But before you go there, I want to make sure you click on subscribe and ring that bell icon, go straight into my chat with Munjaal. This one's a long time coming for us to do this. I actually want to set context for everyone watching as to, we're going to talk about, pregnancy, infertility, IVF, a lot of aspects, right? But I want to go back to that message I sent you all those years ago when Pooja and I were trying to have a kid for a while. We'd had multiple failed pregnancies. We'd gone through IVF. We'd gone through many things. We'd just kind of given up. And then I sent you that message and you said, just come over.
Yeah, it seems like
a long time ago.
I think a decade ago.
Yeah,
almost a decade ago. For people who, are watching, Varun and I know each other online since probably 2009.
Yeah.
Right? I think when Twitter first started.
Yeah. And I remember that distinctly because Pooja didn't know you. And Pooja had kind of been through this cycle of meeting so many doctors who, Pooja is someone who's an extremely confident person. And then she went through this process over many years of feeling like she was failing at something.
Yeah.
And that really hit her hard. And then I remember one of the first things you did was sit us down and say, guys, just go take a break for some time. And then come back and we can work this one out. And there was something, I know that she left reassured.
I don't remember the conversation in the cabin. I'm blank. But what I do remember is that I was seeing a few patients and that at that time Namaha was relatively empty.
It's a new hospital at that time,
New hospital. There were probably 3 or 4 couples waiting outside. That's about it. And somebody else was inside and I walked out and I saw you. That's the first time I ever saw you in person. I've always followed you online. So I knew what to expect. So I was like, oh, Varun's here. And Duggi's here.
Yeah.
And I saw Pooja and she was in a whole CEO zone, very skeptical. This is another doctor, very reserved. I think a little justifiably, skeptical.
Yeah.
And then I remember coming in and going through all your files, a lot has happened. And the only thing that actually went through my head was that, look, the priority here is not the baby. The priority here is, at that time, not even you. It was Pooja because clearly she'd been through a lot. And she can have a poker face, but at that time she didn't. She was like, don't
put me through this again.
Don't put me through this again. And then we were like, okay, we'll figure it out. And we went through all the negatives first. That the worst that can happen is we decide to do nothing and you're fine the way you are. And I think that was like, okay. I think that set the tone. Like, we can do nothing and it's okay.
Yeah.
And I think she liked being at Namaha. I think she was like, okay, I like this hospital. I like how people are, and the team was friendly.
Yeah.
It wasn't a factory. She wasn't sent to 5 counter. I think she mentioned all of this much later.
Yeah.
I think she just was like, okay, here I can say no. I won't be pressured into saying yes to something just because I'm supposed to.
Yeah.
I think that started the ball rolling.
Because I remember by the time we came to Namaha that day, we'd been through a cycle of, when most of us are so blind to, or maybe just don't see the fact that infertility is such a massive problem, right?
Yeah.
I remember the first day I walked into a hospital to even get a consultation. I'm like, there's so many people waiting. I'm like, wait, all these people have an issue with having children?
Yep.
You assume that people having so many children around, it's easy, right? The first time when you get pregnant as a couple.
It's a concentration of couples in need.
Yeah, because the first time the miscarriage happens, you don't expect it because your assumption is, 1 second, it's a natural process. You will get pregnant, you will be careful, you will have a baby. Yeah. But after the first miscarriage, it hits you, and then you walk into hospitals and you see there's so many people around. So you also feel like, okay, there's so many people who actually want to have children but can't. So the pressure kind of piles up. And we went through, like you said, multiple iterations, places where people would pressure us to, take certain decisions, places where weirdly comical situations would happen in terms of what they would suggest we'd have to do. And then eventually we walked in and you made it about Pooja and made it about us and how we need to be okay first.
Yeah.
And then make it about having a baby at all.
Yeah.
Which makes sense, but it doesn't happen that way.
And also, I think Pooja and I got on very well from the get-go. Like, I really got Pooja. Like, all doctors and patients don't get along. Yeah. And sometimes a certain doctor may not be the right fit. Yeah. Weirdly enough, Pooja and I were great. Yeah. Like, I was like, okay, listen, we're in this together. And it wasn't an act. It wasn't like, okay, we're on your team, don't worry. We were genuinely rooting for her. Yeah.
Before we get into the technicalities, I want to talk about just because you obviously see a lot more people going through this than I would. Yeah. How, from a doctor's perspective, what do you actually have to do to make sure how do they go through the process in the best possible way?
The first thing is, I may be wrong. There are different ways to practice. The same way there's different ways to be a sports person or somebody in film. But for me, I think other than medical education and being efficient at your job and being skilled, being talented, a lot of it also has to do with you being a people's person. You have to be able to be a part of their life. So I'll have Varun and Pooja coming, creative people, executives, well-educated, run their own companies, etc. And the very next stage, I'll have somebody who's, not from the same background. I need to be able to fit into both their lives. So that's something, I don't know if it can be taught, but definitely it's something, if you aren't born with or haven't seen since you were a young kid, it's an important skill to acquire. And that either comes, genetically, or the way you've been in school, or through a mentor, by observing somebody senior, like, okay, that's the way. You need to be able to speak to somebody who drives a rickshaw, and you need to be able to speak to somebody who probably drives a Bentley. Yeah. You need to be able to seamlessly inhabit both the worlds. And patients are not stupid. They can see through an act. You genuinely have to care.
Someone who's clear with you, right? I think what ends up happening a lot of times, and I come from this family of doctors, and I always wondered this question, right, is that, it's sometimes when things are overtly technical, when it's explained, people don't get it. So they tend to just take it either on face value or suspect it, which seems to also be a broader thing that keeps coming up in this case. So if I'm a young couple today and I'm having issues conceiving, before I say, okay, doesn't mean I have to go for IVF, what would the first thing that you'd have to think about? What should you kind of focus on?
I want to go back to what you said. I think that's very important. When you said that when things get overtly technical, I see this a lot. Even when people are explaining surgery, people are explaining therapy for IVF, I'm a fierce believer that if you're a really, really well-educated, talented, articulate person, if you are thorough in your field of expertise, you will be able to distill down a very, very complex procedure and explain it to somebody like they're 5 years old. If there's an inability to do that, there is a fault in your clarity of thought. So that's the key. You have to be able to first distill down that procedure into very basic words.
Yeah.
Even a 5-year-old should be able to get it. Once that happens, people are not stupid. The follow-up questions will become more and more complex. So that's the way you go.
Yeah. I actually, so my dad's a doc, as you know, right? And I've asked him this in the past. And I'm saying, and because he once told me that people just tend to Google things. I'm like, I think people Google things because they don't understand what the doctor is telling them.
Yes.
So rather Google and kind of get that response, which again is not the best idea ever.
I mean, it's not the best idea, but I don't frown on it. Like if somebody tells me that, I've Googled this and now ChatGPT did. So they'll be like, I've put in all my reports on ChatGPT. This is what it spat out. It's fine. The only thing I would always tell them is that, look, whatever comes up, don't obsess over it. Don't take it at face value. Use that as fuel to make your notes properly to ask me. So all ChatGPT or Google or whatever other engine you're using, use that to distill your questions or to increase the number of questions which you'll ask me. Okay? Because sometimes you may know something more than me and it's good to ask me. So I'm okay with my patients Googling all the time. The only thing I don't want is that I don't want you to panic at 2 a.m. thinking, oh my God, I'm dying.
Because you can also go down that spiral, right? I think the problem is sometimes you'll see something, you'll Google the symptom, and then you'll go down, and suddenly I agree. At 2 a.m., you're going to be like, oh my God, this is what's happening to
Everything
me.
eventually, according to most of my patients, leads to cancer.
Yeah.
So, I mean, it's silly. When someone will ask me, Doc, you're giving me this, but I read that this could eventually cause this. And I'm like, have you read the brochure for paracetamol? I mean, in rarest of rare cases, even that could lead to liver failure.
Yeah.
Like, oh, I never thought of that eye pop.
There's always a test case for everything, right?
So let your doctor be the final say.
Yeah.
But it's not wrong to research. Research away. Use good sources for research. Don't go down silly blogs. A lot of blogs are clickbait. Nobody wants to read like a boring story.
Yeah.
How was your IVF? It was average. I made average number of eggs, average number of embryos. I conceived. 9 months went okay. I delivered. Where's the fun in that?
Yeah. So you'll watch the most hardcore.
That's it. After 8 failures, after 3 miscarriages, almost bled to death, severe complication after IVF, fringe cases, but they get the most hits. So you need to be able to distill down what is actually relevant to you. It's the same as planning a holiday. Like if you're looking at reviews for a hotel, I do the same thing. I go first and click on lowest. I'll read the lowest first, but that is the accurate representation of it.
Yeah.
So you need to have a more balanced view. Same thing with medicine.
So instead of watching those things, I go to the second part which I asked you earlier, is that if I'm a young couple and I'm like I'm having trouble conceiving, I'm doing the Googling, I'm watching all these videos, what should I actually do first?
How young? Varun, we are still young.
I've been yes.
So if you are, say, a couple in your late 20s, you've been trying since a couple of years, trying since a year and not being able to conceive, visit a gynecologist.
Yeah.
All he'll do is run a bunch of tests to see if you're not in one of those rare cases where the sperms are an issue or the eggs are an issue or some other pelvic anatomy is an issue. If, say, you're somebody between 30 to 35, the cutoff is about 6 months or so of proper trying. Once that happens, the doctor will tell you to do a bunch of tests, husband's semen analysis, we'll do an ultrasound, give you probably a few more months with supportive medication, probably explain to you what is the best ways to be together, what are your fertile days, what to use, whether to use lube, not to use lube, etc., etc., etc. Probably people have a lot of misconceptions about when ovulation occurs. People have a lot of misconception about using lube or not to use lube, what kind of lube to use, if at all to use lube or no, etc. So it kind of clarifies a lot of things, even lifestyle issues, smoking, weed usage. Fairly common. Alcohol, whether it's okay, not okay, etc.
Like I remember I asked you this question, right? Is that I've always taken creatine as a supplement along with protein.
Yeah.
And I remember asking you, does that affect this? And I remember what you said. You said that why don't you just go off it for some time?
Yeah.
And see if it makes a difference. And it actually didn't. It was still the same problem. And so like you have your answer there.
Yeah.
So sometimes just like if you feel something might be a problem, just eliminate it for some time, come back.
It wasn't me who said why don't you go? It was your wife. I said, just stop taking it, Varun. And I was like, okay, I can't disagree with Pooja. He's saying what's going to happen? Like taking a break research doesn't support that any change will occur if you go off it or on it. It's just fuel for your muscle. However, sometimes try it. You never know how your body is going to react. But in your case, it didn't make a difference.
I've actually also spoken to so many, and I've realized over time that there's so many friends I have met who've also been through IVF, who've been through this process. There are so many misconceptions around it. There's this whole thing that it's not it's not natural. To it can cause multitude of issues. It's a scam is the thing you get told a lot. And people push you towards IVF when you don't actually need it. There are so many things around that. So I want to actually go to making that choice in conversation with your doctor and saying in which cases does someone need IVF?
So for the first thing, I get this a lot. So whenever we get a patient who has slightly sketchy reports, maybe a low AMH, that means lesser number of eggs than is ideal for your age, or even if you're a slightly older.
Actually, I'm going to take a step back. So I explain that. Let's go back to infertility happens because of either lower number of eggs and lower sperm count.
Not necessarily. Okay. So there are a multitude of factors. It will be one, few, or all. The first thing is the commonest cause of infertility or subfertility is unexplained.
Okay.
So that's more than 50%. About 60% of the cases which come generally for people trying to conceive, they'll undergo all of the reports and all of them will be normal. That's the most perplexing for the couple. As a doctor, we know that, okay, when it's unexplained infertility, all it needs is a little bit of a push. Most couples hate that push. They'll be like, I want to know the reason. Why is it not happening? My sperms are great. Eggs are great. Cycles are regular. Ultrasound is great. Tubes are open. We've been trying since a year and a half. Why is it? Are we missing something? The point is, most of the times you're not missing anything. It's just that sometimes, probably only in your first attempt at pregnancy or one of the attempts at, for one of your kids, a little bit of a push is needed. All your doctor will probably do is give you some pills to make sure you make a better egg that month or make a couple of eggs that month, give you the dates to be together, etc., and you will conceive. That's the hardest couple to crack.
Because you don't have a reason.
We're so used to, as a species now, to have data for everything. I want to know why. Like, then I have to tell them, would you really be okay if I told you your sperms were really, really bad? Like, would that make you feel happy that, okay, now it's not just a matter of time. It's like me having to really intervene. And they're like, okay, that makes sense. I have to say, would you really be happy if you had like a bunch of fibroids in your uterus and we had to operate now and then say, okay, then we'll try again? Like, okay. Then it's easier to digest that, okay, organically, there's no organic pathology that we need to solve. It's just a matter of time, or just a little bit of a push with maybe pills or an intrauterine insemination or even IVF, etc. is required. But it's not for something dramatically wrong. Beyond that, once things start to come wrong, it could be either with the female partner, it could be with the male partner. With the male partner, it's usually a poor sperm count, maybe less number of sperms, poor quality of sperms, less motility of sperms for various reasons. Either he's born with it, either it's smoking, it's some form of nicotine abuse. Either it could even be some physical ailment, such as having some bad viral infection in childhood.
Does alcohol affect it as much as smoking does?
Not as much. However, people who are generally drinking every day, not only does it affect the performance in bed, the quality of sperms also deteriorates a little bit. So it's more than the quality of sperm. It's like if you really want to like try regularly, sustain a good erection, a little bit of control in your alcohol is better. Yeah.
Okay.
And for the female partner, it's multitude of things. Number one, eggs. Yeah, so you should have enough eggs, good quality of eggs. Your uterus should be great. Your tube should be great. Your cycle should be predictable, etc., etc. So yeah. So once all of that is evaluated, you proceed, and then wherever there's a flaw, you start treating.
Okay. And then coming to the choice of, okay, naturally it's not happening with pills. Now you have to make the choice to do IVF. At which point does that happen?
Also, this natural thing. I'm allergic to that.
That's the term, right? You'll say, we can have it naturally.
Everybody says it. Doc, I always wanted to have it naturally. And I'm like, wait, how did you come to Namaha today? You came all the way from, say, South Bombay. How did you come to Namaha today? You came all the way from Bandra. You came all the way from Borivali. Wherever you've come from. So we drove. I said, why? Why didn't you just walk? That's the natural way of travel. Why would you sit in this steel aluminum body with flammable liquid, powering it through a road surrounded by people?
Yeah.
So if you're going to fly abroad, you are not going to. If you want to go to London, you're not going to swim to London. You're going to sit in this metal tube hurtling through the air. How in the world is that natural? 300 years ago, people would think it's a figment of somebody's imagination. 200 years ago, Varun, 250 years ago, I would have been a disabled person because of my eyesight. I would not have been able to take up weaving. I wouldn't have been able to take up stone carving. I wouldn't have been able to be a worker on the Taj Mahal.
Yeah.
I wouldn't. I'd be like a manual laborer in the farms because my eyesight is weak. I don't wear my spectacles every morning and think, oh my God, this is something unnatural I'm putting on my face. Over time, this has become a natural way of life because it makes my eyes the way they're supposed to be. The same thing with fertility treatment. If your egg count is low, if your sperms are low, we're giving you certain medications which may seem unnatural right now, but the effect it has on your body, it makes you the person you're supposed to be. So once that understanding comes, I'm like, that's not a bad way of putting it.
Yeah.
And if I tell a couple that, look, if this was your grandfather in the 1960s or your grandmother in the 1960s or the 1950s, they would live a childless existence. Or they'd probably adopt one of their relatives' kids or adopt a child or however society used to work at that time, but they won't have their own kid. Why? For the simple reason that his sperms are there, but there are few, not able to reach the egg. Now we can make it reach the egg. Just the fact that you have doctor-assisted pregnancy as a label on your file.
Yeah.
I mean, it's not really a label. Nobody puts that on the file, but psychologically thinking that, oh my God, this is one natural act that I'm supposed to do. I'm not being able to conceive my own child. You are being able to conceive your own child. You're educated enough. You worked hard enough in your life to seek help. That itself speaks volumes of where you've come. So for me, this
obsession with natural. Yeah.
No, it's fine to be obsessed with natural, but not at the detriment of something you want. Not at the detriment of the plan you have in your life. And it would give me... It hurts me that somebody would be like, I just can't do it because somehow they have this mindset that I'm just supposed to do it one way. There isn't always one way for everybody. So I'm like, seek help when you need it. If you have a heart attack and if a doctor tells you need a bypass surgery, you don't be like, no, I'm just going to breathe well. I'm going to do some breathing exercises. I'm going to try to remove stress from my life, and I'm just going to... All of that will help in the background. But when it's an acute event, you are supposed to take medical help if you want to live. Same thing with this. If it is like this, allow people to help you. Allow people to come onto your team, be your allies, and make it happen for you. So that's what I think. Of course, At no point do we pressurize somebody to undergo treatment. But it's just important for them to understand that it's not defeat.
Yeah.
Not being able to conceive is not defeat.
That's actually the thing, right? Is that there's this word that's used called, failing. Right.
I've used it.
Yeah.
When our first kid is also IVF.
Yeah.
So when Riddhi and I were trying to conceive and we couldn't, etc., there was a time where I had this thought. I think I told my wife also at that point of time that is this how natural selection works? Is this really natural? Are we going against the laws of nature by doing? And I'm a gynecologist. I mean, at that point of time, I was just starting out as a gynecologist, but nevertheless, the thought crossed my mind as well. And I thought at that point of time that are we ruining the natural order of things? Are we genuinely not? Are we not good people? Maybe we're just not good people. Maybe we aren't supposed to procreate. Maybe we don't deserve a kid. Maybe our kid doesn't deserve to come because we are the bad bits of society, probably.
Yeah.
And 13 and a half years later, I'm like, what nonsense was going through my head when I see my daughter today?
Yeah.
Like how stupid. But I was very vulnerable at that time. I was very defeatist at that time. I was very insecure at that time. I hated it that people around me were having kids. People who didn't want kids were having kids.
Yeah.
Friends, family. You feel inferior. You feel you don't deserve it. But having gone through it myself, I am this fierce proponent of you deserve everything and more. Do not ever believe that you don't deserve it.
Yeah.
Because sometimes, it takes a decade to understand that you're worthy of everything that you dreamed of.
Yeah. And just because the daily process going through, I remember you used to keep telling us that take it one day at a time, because every day comes with that scare of something could go wrong, right?
Yeah.
You're going to rush and try and do a scan to see if everything's fine. You also in every time you have a miscarriage, you again go back into because we went through so many as a couple, and I know that
that was Pooja.
Yeah,
that was Pooja. She would tremble before an ultrasound.
I remember this,
and we had this
holding her hand, standing there and saying
unspoken agreement.
Yeah,
that as soon as we start the ultrasound, the first thing that I would put the probe, and the first thing I would look for is the heartbeat until everything is fine. And then I could feel that release.
I'll tell you why. And I think we've both spoken about it, is that most times you go for an ultrasound, you wait in silence.
Yeah.
While it's going on, waiting to hear, and you are told everything apart from that, and you're only told that in the end.
But the other thing is that as in Namaha, in Namaha we have the ultrasound machine, but in front of the patient's bed there's a big ass TV.
Yeah.
So whatever I see, they see as well.
Yeah.
I've noticed this. If it's a first time mom or somebody who's not had a terrible experience, I mean, good for them, but who've not had a terrible experience, they have this light in their eyes where they're looking at the TV screen, looking at the baby. They want to see the face. They want to see the hands move, the heart flickering. Everything is great because you don't have the baggage of... Anybody who's had a poor experience in the past never looks at the TV. They look at my face. Pooja did the same thing. She never looked at the TV. All she did was look at my face. And she told me that the first time she miscarried, before the doctor took about 15 or 20 minutes to say anything, she said, I knew from the way the doctor's face changed when he was doing my scan. And then he called somebody else in, I think. I'm not sure if I'm getting the story accurate. I think somebody else came in to concur that, okay, is it really... So we've lost a kid as well. So I know what that feels like.
Yeah.
So the only thing Pooja was like, Munjaal, once you first tell me if everything is okay. My only priority at that time was put the probe, see the heartbeat, look at Pooja and say, it's all good.
Then do the rest of it.
Yeah. And I think that kind of worked for us through both your pregnancies. She was there. So that's the one thing she wanted.
And, I think of the period before we came to you, right? You only realize the things you have to go through when you go through them in this case, because it's like this hidden world and it comes across. And I remember, for instance, going to, and sometimes you don't realize it, when I said unintentionally funny, is I remember the first time we were talking to a doctor, and she sat us down and she said, to have a child, you need a man and you need a woman. I laughed and she was offended. And I'm like, but
Yeah.
it seemed like an obvious thing to say, but I was like, I thought she was joking. But then she, obviously, but then the way I remember she was, and obviously I will not name the doctor, was supremely cold at all times. Not at any point. We had just lost a child. And we had gone through the process of healing ourselves and then finally taking the step to, okay, let's go meet a doctor. And the first thing you get is this. And then you go through that thing. And we went to, and you'd keep going to clinics and we'd keep meeting different doctors. But I feel that one of the things that I realized is you sit in that waiting room and you're surrounded by this silent desperation that is all around you. You can sense it on everyone's faces there. Everyone's come with a certain amount of, you come with hope, right? I think in this case, in the waiting room, you have that silent sense of hope saying, here, maybe it'll happen for me. Or this time, maybe it'll happen for me. And I remember Sheena sitting saying, it's not reassuring to feel like it's not just us, but you do kind of sit down and feel like, okay, it's a process everyone's going through. So you kind of feel like there's a weird community feeling that comes with it, because you know that there's so many people going through it.
Yeah.
And that really helps. I've just talking to people who are going through similar or have gone through this journey really helps. But most people don't share enough of that because of their own feelings of like, either don't talk about it or they just worried about, like, many people don't even want to talk about the fact that they went through an IVF or something like that.
I mean, I don't judge people for what they want to share about their private lives. It's okay.
Yeah.
It's fine. But there are a whole bunch of people who do now.
Yeah.
And a whole bunch of people, and a whole bunch of women who wear IVF as a badge of honor. There are a whole bunch of people who've started speaking about miscarriages and how they can probably help somebody who's going through it. It's hard to lose a kid.
Yeah.
It's hard. Whether it's in your first trimester or it's later on in life, it's never easy. So somebody who's gone through it probably telling you that, look, it doesn't get easy. You're never going to forget it, but better things will come. Like good days will come. It's not always going to be down in the dumps. It always helps. I've always found myself weirdly, I have to stop myself sometimes, even in front of patients, that, okay, I can't share my example with all my patients. I don't want to advertise my personal life, but sometimes it kind of will slip out. That, look, I've been where you were. You know, this is how it happens. It's not going to go away, but we'll get through it together. We are here. There's this little bit of a bond that kind of develops. So,
I mean, I also think back on the process we went through, and there was also this period where, just to understand how it works, obviously it's, for men, I'm not going to use the word simpler, but the process is shorter. Because you pretty much have to do a deposit and then you're done.
A few minutes.
Yes. But for obviously a woman to go through this long cycle of, let's say, injections, pills, go through the process. I also know that I wouldn't say it takes a toll on you as a couple, but it also kind of brings you together. Like for us, it brought us together. But I've also met many couples where it becomes a point of tension through the process as well. Because, like I said, the journeys are different individually. The journey together is the same.
It also depends where the problem is. So, if it's a female factor, if it's a low AMH, the sperms are great.
So low AMH basically have lesser eggs,
number of eggs. Yeah, either because you're slightly older, or you can have low AMH even when you're younger. But for whatever reason, if you are low AMH and then you need to take a lot of injections to make your eggs and do IVF, somehow it's a little more palatable. Unfortunately, if somebody has very, very low sperms, all he still has to do is do it in a cup.
Yeah.
And then the female partner has to take all of these injections. So the burden of IVF is much higher on the female partner.
On all cases.
In literally all the cases. It depends how you are as a couple. I believe IVF exposes you as a couple to each other.
Yeah.
A little bit. And you have to be very careful with that. As a healthcare provider, you need to be very careful with that. And even as a couple, between you and your partner, you need to be a little more careful.
Yeah.
We try to constantly emphasize that this is a time, this is something that you both have to kind of get through together. You're one team. There's no blame game here. It does happen sometimes because, and you have to be a little forgiving of a little bit of an outburst or a meltdown that can occur.
Yeah.
It happens sometimes. Like, you're like, but I have to take so many. What does he have to do?
Which is true.
It is true, but you can't change biology. You can't change science. You can't change how. If I could, Varun, if I could put a baby in you like a seahorse, I would. Unfortunately, that isn't.
Yeah.
It isn't possible.
Yeah.
You know, Pooja would have to take the injections, or any other partner female would have to take an injection even if the issue was not with her. So yes, IVF does expose you as a couple.
Yeah.
You need to kind of be on the same page, and your doctor needs to help you. I put it very simply that look, right now it's this, but later on, if you had some ailment in your life, I'm pretty sure your husband would step up and do this, that. You need to kind of goad them on along the way.
Yeah.
And it's transient, right? Strife is transient, physical pain is transient, the injections are transient. They don't last for. It seems like forever, but it doesn't last forever. And if the results are good, when you're 9 months, that 3 weeks of torture seems a little smaller.
Yeah.
When it's your baby's first birthday, it feels like a fraction of time. When it's the 5th birthday, you're like, those 3 weeks, they were bad.
Yeah.
But what I have now, so you kind of eclipse the bad memories with the good ones going forward.
Yeah.
And for all the men, the only thing they can do is like just be kind, be supportive. It's easier said than done because a lot of couples they haven't gone through much in their lives. When Riddhi and I went through IVF, I was like an idiot. I didn't know much. I was a gynecologist, but I was seeing it through the prism of a doctor. I have tons of regrets about how I was during our IVF, and more importantly, how I was during pregnancy and immediately beyond, because all I did was saw everything through this prism of a doctor. Like from this scientific perspective. Why isn't this happening? Why is this level this? Why is she crying? Like if my daughter was crying, why are you not feeding? I never had the life experience to, practice what I preach now. And being from a doctor family, everything is kind of understood that, okay, like you're not treated with kid gloves for all, because it's like, okay, you want to do a scan, we'll just do a scan. You want to do a test, you'll do a test. When it's a patient, you're a little more, careful. So if I could, I would do so many things differently for my life.
Yeah.
So I don't know about others. So even if a husband isn't stepping up sometimes it's not that he's an idiot. It's just that he doesn't know any better.
Yeah.
The same way, if the wife is having a little bit of a meltdown, she's not wrong or right or anything. It's just that, look, man, they're growing as a couple. Someday over the next decade, they'll think of this as something that fundamentally changed their relationship. They became better because of it, or probably exposed some things in their relationship that they need to work on. So, I mean, life is long. You can't be perfect when you do IVF. You're never going to be perfect. We are not perfect now. I mean, speak to our wives. They should have a podcast on their own, and probably 3 hours of grievances will be aired. But as long as you're willing to accept that, look, I'm a flawed individual and I'm happy to learn, that should be good enough.
Like, I remember when we had, I think, a second or third miscarriage, right? There was this. So my process of dealing with any of these things is go full shutdown and move ahead.
Yeah.
And so I would do that. So the first time, second time, and Pooja would obviously have to not just go through this emotionally, but go through this physically, right? Because you have to go through a procedure even after you miscarried. And she would be like, "Why are you shutting down?" And I'm like, "Because I'm processing it this way." But what she required was for me to be there. And I remember at that time we sat down, and I was like, I think it was the first time we sat and said, "This is how I process, and this is how you process." And we both figured a way that how will we individually process it, but how should we also process it together as a couple? I remember that moment kind of like shifted a lot for us. Till then, we were like individuals who were married. I think at that time we really got like stronger because like this is something we do together, and this is something which we do as individuals, and not like suddenly make it one or the other. And I remember that really helped. But more than that, I mean, and not to make it a gender thing, but I feel most guys, if you talk to them, they're like, I don't know what I'm supposed to do.
But the way fact that you're articulating it like this, and that you and Pooja had this conversation, that look, Pooja having enough of insight to be able to tell you that why are you shutting down? I need you to give me a little more affection.
Yeah.
Maybe touching, hugging, just kind of be around me rather than like withdrawing into a shell. And you telling her that this is how I process it, you process it. I never had any such self-awareness. Man, I was clueless. I didn't even know why I was throwing a tantrum. I may have been hangry, I may have been cranky, I may have had a bad day at work. I had no idea what the hell I was doing. I'm pretty sure, I mean, Riddhi will always disagree. I'm pretty sure she had no idea what she was doing either. We were just like two young kids just tumbling along.
Yeah.
Okay, we've known each other since we were 17. We think things will work out.
Yeah.
What's going to happen? We'll see. We started seeing each other, randomly became doctors, post-grad happened, went abroad for our fellowships, came, like life was okay. Endometriosis, surgeries happened, everything will work. We grew up very quickly.
Yeah.
That
you grow up very quickly when it happens.
Without any awareness of it. All the buzzwords, all the keywords and all have come into our vocabulary much later, probably in the last like 7-8 years.
Yeah.
We had no such resources at our disposal. We were just like, okay, this sucks, man.
Yeah.
We lost our first kid. She's crying on the bed. I'm crying. I mean, that's it. Wept every day probably for a few weeks, I think.
I remember talking to a couple of friends who'd come to your hospital, right? Come to Namaha, and they eventually did have kids. And
they eventually did have kids.
Eventually did have kids. They did have kids. And I remember sitting with them, and Israel had so many people from his family who turned to him and said, "But it's anyway, it's a woman thing, na? So why are you stressing about it?"
Everybody from his family.
There's some people and he's like, "But I'm still a part of this. It's just because it's not in my body."
Yeah.
Doesn't mean that I shouldn't have this thing. And maybe no, too good tension le raha hai. And he's like, and I'm like, I didn't want to make it a generational thing at that point, but I was like, at some point, the fact that you are even seeing this means that shouldn't bother you. So maybe they might not know how to react to it. They're saying this, but in your case, you do know, so you are. And the more dads I'm talking to in recent times, people who've been through, because suddenly I'm slowly meeting more and more dads who have gone through this. And they all have this thing about saying, I don't know what I'm supposed to do. In being a father only, I think every father has this thing. But on secondly, when something like this happens, you don't know what your natural reaction needs to be. And all you are thinking about is, I want to make sure my partner's fine. And I was like, that's all you have to do. Yeah. There's nothing more you have to do, because there's nothing more you can do if the problem...
But I'll say vice versa. I mean, yes, you have to make sure your partner's fine. But for a lot of patients also, sometimes even the male partners overlooked. It's a couple thing. Heartbreak goes both ways.
Yeah.
So look after each other is what probably I'll end up saying.
Yeah.
A lot of the times you kind of lose yourself in this entire process of IVF. It's also your baby. If it's a loss, it's also your loss.
Yeah.
A lot of men forget, or a lot of dads forget to process their own loss. And that kind of, sits back and festers and grows and, takes over all the darkness, and how you are. It's important to talk both ways. So I mean, like I said, Varun, I was like massively clueless. Sometimes I feel like I'm massively clueless even now. But the only thing is that I never thought I'd be a great parent or even a good parent. I thought I'd be like a clueless parent.
No.
I'm not. Like clueless husband, clueless son, clueless brother, clueless career person, clueless businessman. Pooja has reprimanded many times. What are you doing? You're not being savvy enough in business. That's all fine. But as a dad, never thought I'll take to it like a duck to water. But yeah, one thing I'm proud of is like I'm sorted. My kids think I'm my kids. When your kids think you're an idiot, like you're a silly idiot, you've won as a dad.
Yeah.
That's it. That's the aim.
Yeah. It's also the period that after you have a kid, that first 6 months is like this. I call it Big Boss. It feels like you're in Big Boss, right? You didn't sign up you didn't realize you're signing up for a reality show. You're there for the first 6 months, especially. Your life has been hit by something, and you have no clue what is going on. Like forget sleep to gaya. But in general, like I remember after the first 2 months, I think Pooja came and shook me saying, "Can you stop being a zombie?" Because I was mechanical. I went from, okay, what are we supposed to do? Baby to bed, feed, handle poop, like just literally like a cycle, go in that cycle, and no, like I don't remember having emotional reactions. I only had that. Then one tiny finger held my hand, thumb, and then I was done. Like then
you called me. If I don't know if you remember this phone call.
Yeah.
2 months after.
I actually don't recall.
Yeah, 2 months after your first baby, you called me and said, I need to speak to you. Like what happened? No, something. Whenever you have the time, I was like worried. Like what happened? Pooja with the baby went to the next to my call. What happened, Leah? Okay, everything's fine. And you're like, no, I'm just not feeling it. I'm like, what are you not feeling? I'm not feeling euphoric. I'm like, I don't understand what you're trying to say. You're like, people are like, I've had my kid, I'm on 7th heaven.
It's magical.
It's magical. I just don't feel that magic. I'm like, dude, welcome to reality. It's not magical.
I didn't feel anything. First two, because I feel for us, we spent so much time focused. It was like a mission, right? We have to have a baby. We focused so much that when the baby came, we had like not prepared ourselves mentally for what it was. So when it happened, relief was the first emotion. Then, okay, let's get into action.
Yeah. So it depends also how for you guys, it was such a release phenomenon once you had your baby. And then like, oh my God, there's this new journey we have to pick. You thought that was the end of the ride.
Yeah.
It was, you were on some Disney
8 years later, I have a lot more to share.
I wish my wife hadn't come to the studio today. Because then I was about to say,
she's behind the camera here.
Such a hands-on dad, Varun. I don't know what you're talking about. First 3 months were a breeze. I was changing a diaper in my sleep, feeding the baby, feeding. My wife was getting 12 hours of sleep every night. So the day shift was hers, the night shift was mine. Yeah. I was an excellent dad, never nitpicked, never fought with my wife, never did anything. I was like a brilliant father. Unfortunately, the opposite is true. I was the weird one for the first 3 months. Like I would freak out.
Yeah.
Like she would be like this calming influence. Relax. It's only a little spittle. Why is he burping? Why is he puking every night? Is something wrong with his digestive system? Does he have this pyloric stenosis? Does he have something wrong with his gut? She's like, relax. It's just puke. I'm like, but that's a lot of it. Why is he having fever? Why is it not going? Man, I was freaking out. I was freaking out. Like, you know how calm I am in Namaha? Polar opposite. Polar opposite back home.
I said, I was asked recently, right? Someone who's going to be a dad said, what advice do you have? And I said, the only thing, apart from the fact that get as much sleep as you can now before you become a parent, because you will not get any after that. I just basically said that you need to take care of yourself as much as you feel the need. I feel what happened for me in that first 3-6 months is I was so razor focused on, is Pooja fine, is baby fine. At some point of 3 months, I was so zoned because I was doing the nights. Because I didn't know what to do. So I went to Pooja and I said, okay, what do you not want to do? And she said, I don't want to handle diapers and poop if I have the option. I said, perfect. I'm very good with poop. Please hand it to me.
Very savvy.
I have still handled more poop than I can put this on the record. I have handled more poop of our children. I don't know if you're going to beep the poop. We're not beeping this poop.
Can we curse on this podcast?
Curse as much as you want.
Yeah?
Yes.
Okay, cool.
Yes. Handle more poop, done more nights as a father, because I was like, what do you not want to do? She said, don't handle poop. I want to try. I need to get sleep. I said, I'll do nights. Today, I am surviving on 4 hours of sleep because my almost 3-year-old has decided that he'll wake up at 4:30 a.m. for no reason and wants to go out. So I have not slept last night. And but it's just that I'd start with that, and then it become mechanical. Okay, I'm doing these things for her. I'm doing this thing for Leah. I think 3 months later, I remember speaking. Now I remember speaking to you, and I remember a friend literally taking me out and saying, "Just take care of yourself also. Just chill a little bit, then you'll feel it."
No, you have to keep telling yourself, this is fine. Like, who defines these standards? Literally, like, everything around us is constructed to make you feel bad. Literally everything around you is constructed to make you feel inadequate. In medicine, especially, in reproductive medicine, for sure. So if you can't conceive naturally and your brother did, if you can't conceive naturally and your friends did, if you can't conceive naturally within a month of trying, you're inadequate, man. Now you've conceived, if you didn't deliver vaginally, naturally, if you had a C-section, I'm such a coward. Couldn't go through vaginal birth, etc. I mean, some people out of choice may not want to do vaginal births. I mean, if you want to do, great. If you don't want to do, great. If you need a C-section, again, you've not lost in any particular way. Breastfeeding. You're not breastfeeding. My kid used to just breastfeed. I used to have so much extra. I used to keep freezing and keeping. It's fine. Some people have enough supply. Some people don't. Some babies latch well. Some babies don't. Some mothers take to it like a duck to water. Some don't. It's fine, man.
It's an individual journey.
It's an individual journey. Tell yourself, like you said, what's the one advice I can give parents? Look at yourself and say, look, man, I'm fine. I'm doing all I can. I'm not harming my kid. If I couldn't do this, I've asked my healthcare provider for what is the next best thing that I can do. What are the drawbacks of it? He's told me or she's told me, it's fine. You can do it as long as you take these precautions. Get on with it. Stop trying to kill yourself for it. And the second advice I'll give, since you asked, is something that my wife told me. She heard Conan say, Conan O'Brien, who I love. He said, take as many videos as you can. So we are from the Instagram generation. We've taken so many photos of our kids. Very few videos. And now when my kids are just entering their teens, my wife digs out these gems from her Google photos because they are not constructed for social media, because she was never a big social media person. All my pictures on Google Photos are these beautifully aesthetic, well-placed, with my daughter posing well, eating a nice meal, my son doing something fantastically cute, well-dressed with a bow tie and a tuxedo, everything phenomenal. I don't see myself looking at those photos that often. What really, really are the big hitters now are these spontaneous, candid videos that my wife has taken surreptitiously when my kids are playing on the bed or in the car and dancing to nonsense Honey Singh songs and laughing. My God, Varun, that voice. I would kill to go back in time and hear that baby laugh again. So if any advice...
Baby laugh, baby smell. Two things you want to bottle up and keep, which you cannot, are those two.
And that voice.
At least the laugh you can get on video. The smell you can never keep.
And even that voice, that little squeaky voice saying, okay, Papa, like just that, I would kill for it. So if any new parents or going to be parents are listening, not just pictures, just keep taking, just buy as much storage as you want, keep taking videos.
So I have this, my mom the other day gives me this CD. For people who don't remember what CDs were, we would listen to music on those shiny round things. If there are younger people watching.
What is it, Gen Z? This generation, Gen Alpha?
Now we're going to Gen Alpha now, but Gen Z, I don't know if Gen Alpha is watching this podcast. And that had sometimes like, I've heard this before. And so she reminded me that when I was a baby and a young child, my parents had recorded my voice on audio cassette. And had kept my voice through different stages of me growing up till I think I was maybe like 7, 8 years old. And she had, because she was worried the tape will get spoiled, she'd gotten converted into a CD. And I have a copy of that. And it's just, I agree, there's something to those small things which are random and raw. Those were actually the things that you go back to. The aesthetically set up ones, sometimes you go back to, but you don't go back to as much as you would.
You don't. I'm the king of aesthetically set up pictures. I mean, once king of aesthetically set up pictures. But I'm telling you, you'll see it. You'll see it when they are pre-teens and teens. It'll pop up 12 years ago, 11 years ago. And you are in a car and your daughter's just laughing hysterically at nothing. Absolutely nothing. And you'll be like, I want to be in that car right now.
Yeah. We Googled a bunch of questions that what are people Googling about infertility and IVF?
Oh boy.
Took the most obvious questions. And I made a short list. I'm going to ask you them one
Like a
by
rapid
one.
fire. Boom, boom.
Don't have to go boom. You can go however long you want, but you can decide to make it rapid fire or not. Infertility, the biggest mistake people make is literally one of the things that came up. Like when I say infertility, we just type that one word in. The biggest mistake people make.
Self-diagnose. Go to your healthcare provider. Get proper help.
Yeah. What should someone in their early 30s actually know about egg or sperm freezing and IVF as well?
I mean, there's a lot of online resource to find out what is egg freezing, what is semen freezing, what is IVF. But depends what kind of 30-something-year-old you are.
Yeah.
Are you in a relationship? Are you married? Are you not in a relationship, not looking to get married for a long time? Are you a career person? Are you like, I'm not even sure I want kids, but I want the option open, etc., etc. Go to a fertility specialist. Say that this is what I do. I don't have anybody in my life right now. I don't plan on having anybody in my life right now. Or I'm just getting married, but we're too busy right now to even think of kids. Maybe 3 years later, maybe at 36, maybe at 38. What are my options? Run a bunch of tests. See where you are from a fertility point of view. Ask them, should I do egg freezing? Semen freezing isn't all that required if your sperms are healthy, you have generally good, physical habits, you don't smoke, you don't, no hard drugs, basically it's not on the borderline. So sperms fortunately don't have that shelf life as the eggs do. So for when it's about eggs, then yes, speak to your doctor. Say, is it better if I do it now? Is it better if I do it later? What are the financial implications of it? Can I wait a couple of years so I save 2 years on my freezing cost, etc., etc., etc. So if you're in your mid 30s and you are confused about where your life is headed, go discuss your options.
Since you mentioned the cost, IVF is financially inaccessible. The financial aspect came up many times in what seems to be the highest part of searches. Is it accessible for someone financially?
It's such a broad term, accessible.
Yeah.
And we're living in a society where sometimes the roof over your head is not accessible.
Yeah.
Sometimes just 3 square meals a day is tough. School fees aren't. So in your long line of priorities in life, IVF does take a backseat. Many people, and for whatever reason, it is expensive. So apples to apples compared to other medical therapies, IVF ranks up there, and that's because of the cost of the consumables. However, IVF charges are not uniform. They are different if you are in Bombay. They're different if you are in a small town like Navsari in Gujarat. They're different if you are even in a slightly smaller town than Navsari. They differ in the type of injections you use. So if you are using branded injections or generic injections or, the kind of quality of drug, equipment, etc. that is used. Now, the difference between using the best quality of equipment and slightly nominal quality isn't that much. And if, say, you're a younger couple, you don't need 25 eggs, you don't need 18 embryos frozen, then you could get away with a much lesser cost. However, that lesser cost is relatively lesser. So if you ask me, is IVF slightly expensive for everybody concerned? The answer is yes, it is. And right now, most insurance providers don't cover it. There are some corporate insurance providers that cover it to a degree, only the consumables, etc. For example, if an IVF at some center costs 1.5 lakhs or 2 lakhs or 2.5 lakhs, sometimes even 3.5, 4 lakhs in some centers, it would cover barely like 70 or 80,000 rupees, which isn't less, but I mean, in the grand scheme of things for that person, it's less.
Yeah.
So you need to kind of see where you will be able to access it. A lot of government and municipal hospitals are now starting IVF labs in its infancy and isn't as popular now as it should be. But I think it will happen. Medical treatments similar to medical drugs and similar to other medical equipment comes with a huge, when it's new, it's a huge price point. But slowly gets distilled down as the patents start, expiring, and a lot of other players come into the market. Once more competition comes into the market, the pricing automatically reduces.
Yeah.
So yeah, is it inaccessible? It would be very, very stupid to say it's accessible. Yeah, for the average Joe, and it's hard. Yeah, it takes a hit.
What's the biggest myth about IVF that social media has amplified? Which you get a lot, and you're like, again, one more person's come with this.
The drawback of answering this question
is that you'll amplify it.
No. It's not that I'll amplify it, but it will seem insensitive to people because IVF is demonized on social media by a lot of people. That it's very, very painful. It completely disfigures your body. You put on so much of weight and it's horrible. Now, the thing is that me being a male gynecologist sitting here and saying, no, that doesn't happen is stupid. I don't know. I don't know how she felt. So, no symptom is to be dismissed. No symptom is unimportant. So, for the person who felt that way, I'm pretty sure that it was miserable. But there are doctors and there are centers that go out of their way to make sure that doesn't happen. Is it still going to be a walk in the park? No. But is there potential for your doctors, his assistants, their nurses, their team to ensure that it isn't the worst experience of your life? Yeah. There are enough ways available to make sure that you are not as uncomfortable as you've read. So yeah, I'm not diminishing anybody's symptoms. I'm pretty sure they're all valid.
Yeah.
And not having taken a single injection like that myself, there is no way for me to know.
Yeah.
I do not, I'm not putting myself in anybody's shoes because I can't.
Yeah.
However, do I try really hard to make sure that these fears that they have, try to reduce them as much as I can, or whatever I can to do in my power. And same thing with my team. Yeah, I try really hard, and then I take proper feedback. That was it as bad as you thought, and it's like a little bit of a victory moment for me when they're like, no, it was much worse in my head. It wasn't that bad. So I was like, okay, maybe somewhere we are kind of changing the narrative.
Yeah. And there was one more which you answered, is that a lot of times it becomes, it's a female problem, it's not a male problem. So a lot of men actually don't end up going and getting themselves tested and keep making it, the problem won't be with me.
It depends where you are. In an urban setup where everybody is usually professional, educated, we are finding that less and less. Men are coming and saying, I find it very tough to do it on the fertile days. It's like a gun to my head. It's not fun. It's a chore. Like, they're okay accepting it. In certain other, not only cities, certain other socio-economic strata, educational background, even some communities where आदमी के साथ कुछ गलत नहीं है. As long as I can do it, that's my thing. But it's changing. I mean, women are becoming stronger now. Even in tier 2, tier 3 cities, they're like, no, you get yourself tested. That concept, even like 15 years ago, that concept wasn't there. I would have patients who undergone the same set of, that same set of infertility investigations, that big chunk, one lab, second lab, 1 year, second year, third year, 3 ultrasounds, 2, 1. I'm like, where's the male? Hey, he has no issue. And who's saying this? His mother. I'm like, what? No, but he has no issue. That fear that everything of hers is normal.
Yeah. Shame, no?
And
it's a
fear,
feeling
it's
of
loss
fame.
of power.
Yeah.
That you've been pressurizing this little girl, this woman in your house, that you have not been able to give us a child, and the actual fault, not fault, but deficiency maybe in your son, very hard to take. But again, it depends where in the country you are, how you are as a family.
Yeah.
And I think it's changing. Women know now. This current crop of, I don't see this current crop of girls, even in tier 2, tier 3 cities, they're very empowered. At least most of them. We have a long way to go. They are not going to take all this lying down. And it makes me very happy.
Yeah. I also feel that as the longer you go through the process away from the time when you try to have a child, you tend to only remember the funny moments. You tend to remember only the I feel the joke which Pooja kind of goes through is that whenever one of our children chooses me over her on something, like, is this why I took so many injections that you have to choose him over me? And you find that, and I think that also happens because you had enough of those moments, that you allowed yourself to have those moments while you were.
That's what you hold on to, no?
Yeah.
I mean, even when it comes to couples trying, I tell them just inject a little humor. In your life, like, don't get frustrated with each other, because sometimes, it is hard. If I tell people these are the 3 days you need to have, sex, I assure you those are the 3 days you won't be able to have sex sometimes, because all you'll think of is, okay, it's work, which my doctor has prescribed. Nobody wants my face telling them, now do it. When they are getting in the zone. So I said, like, laugh about it. If it doesn't happen, we'll figure it out. Don't worry. There are enough ways to kind of get you pregnant. So it's not the end of the world if you couldn't get it up.
I was saying this to you before we started recording, is that the one story I keep coming back to, which makes me laugh every time, is there was a time I had to go deposit sperm. And this nurse turns to Pooja and says, you can go in and help him. And the genuine expression on Pooja's face, I will never forget. She's like, what do you mean I need to go there and help him? But it was just like, we mentioned that, we talk about the injections, we talk about the fact that we've had cases where we were in a space and we kind of felt like we were being like you said, sometimes you spot the fact that someone's kind of taking you for a ride. And we spotted it and got out. So we talk about all those things. But as I always do on the show, and I want to close with this, is if somebody's watched this entire episode, and if you're still here, you're part of the later gang, we call it the later gang, what should my key takeaway be?
Having a partner in your healthcare journey isn't like a one-stop shop. You can't go to one and be like, okay, this is how it's going to be, and either it's for me or it's not for me. No. Give yourself a little bit of time. Sometimes it takes time to find the right fit, the right doctor, the right hospital. It's like finding, as we've grown, you would also find yourself gravitating to the few things that you enjoy, and you'll stick to those. It took you a long time, Varun, to find which t-shirt works for you.
Yeah.
Or which shoes work for you.
Yeah.
Of course, the stakes are much different. But for example, it takes time for you to go through. So you're a very fancy guy, so probably Balenciaga, whatever,
none of
all
those
the names
things.
that I don't know. Till you landed on this one really soft cotton t-shirt. You're like, you know what? This just fits me perfectly. It comes back from the wash the way I like it.
Yes.
This is what I'm going to wear. Or it could be a fragrance. Or the same thing with the doctor. Do not let one bad experience shake you or put you off this journey. It's okay. If it didn't work for you, go to somebody else. And like you mentioned, somebody who was very strict with you and told you, it needs a man and a woman. Some couples may need that. Some couples may be very responsive to somebody who is more authoritarian, more teacher-like almost. They'll be like, okay, hum mummy ke paas aa gaye hain, that type of, she's my auntie, she's like my grandmom, and she will like shepherd us through this journey. Fine, that works for somebody. It may not have worked for you. For you, it may be like, look, man, I just need somebody who will speak my language or who understands where we come from or what our background is and speak to us about something just other than this, medical thing. So it's different for different people. So I'm not. It's a buffet. Try it. Don't give up. If you come to us, you don't like a friendly atmosphere. Somebody who's a little more casual, wears stupid sneakers. You're like, the seriousness isn't there here. Fair enough. It doesn't work for you. Go to somewhere where you feel like, okay, I feel better when I'm in this more professional kind of structured environment. Or you're like, look, man, I'm anyways very stressed out. I don't want to go there and smell that injections, and I don't want to smell the the alcohol, rubbing alcohol and phenyl and betadine. I just want to be in a more calm space where I can be like, okay, listen, I need to take a break and I won't be judged for it. Find the right fit is what I'd say. The one takeaway is that just don't give up on it.
Thanks for doing this. This has been great.
Yeah, long time coming.
Yeah, long time coming, and I'm happy you could finally do this. Thanks for coming on the show and sharing everything that you shared.
Happy to be here.